I've had high blood pressure my entire life, and so I've been on blood pressure medication. A previous caregiver had given me medication prescription that turned out to be the wrong prescription. It caused some cardiac type issues like elevated heart rate and some chest pains that, one Monday morning I just headed for the emergency room. And through that process and vetting out what actually had happened, it had occurred to me that now is the time that I really have to seek and find a good cardiology partner. So at that point, I sought out the Swedish Heart and Vascular Group and met Dr. Castorella. He immediately recommended a change from that medication to more of a different type of blood pressure medication, a diuretic that wouldn't cause any of those symptoms. The blood pressure was still controlled, but I didn't have any of those more running to the emergency room. In addition to that, they've recommended a series of tests that gave us almost like a heart checkup. A heart scan, which we did here at the Swedish facility on Cherry Hill, was very telling in terms of just how serious my heart condition was. We immediately went into a maintenance and prevention mode, where we see each other every 6 months, and there's some EKGs taken on a regular basis, blood tests. My experience with Swedish since the beginning has been fantastic. A lot of doctors want to just look at the last piece of paper. And from the onset, Dr. Castorella sits you down, go through it from the basics, and just explain, hey, let's cover your heart history, let's go through the basics, let's go through your family history to today. And that thoroughness all resulted in a very, very good experience for me at Swedish. Well, life has changed substantially since treatment. If you have a serious heart condition or some kind of a serious ailment, life really gets put on hold for a little bit until you figure that out. So there was, the family life was not the same. My wife was concerned, the kids are concerned, and I had stopped working out, which I like to exercise at least 3 or 4 times a week. Now we're in a better place. Certainly Jackie's a lot happier with the way things are going, and I'm out exercising again and doing a lot of activities with the kids. What I've found through my experience with Swedish is a peace of mind, a sense that this is one thing I can rule out. I may have a little ache or pain once in a while, but for the most part, I know that my ticker's still doing good.